Sorry, we're starting off great. Hey to all those seeking environment health, it's Dr. Rachel Northern here, and I'm here today with Taylor, who is a registered nurse and an international, what did you say? Board certified lactation consultant, and just overall awesome person in my opinion. So we're going to talk about hormones since today we are doing, or this month I'm just talking about female hormones, and she's really in tune with the pregnancy and postpartum, clientele, and she knows a lot about this subject. So I brought her in today to talk about it.
Hello. So my name is Taylor Espinosa, and I have a private practice called Callisto Lactation, which she has tagged for you. So if you are interested, follow my page, you can go over there. But we're going to talk about pregnancy hormones and postpartum hormones. I know as a lactation consultant, you're thinking postpartum hormones are probably more your forte, but I think it's important to understand what our hormones are doing during pregnancy, and then why we have this cascade of effects that happen after we have our baby. So during pregnancy, one that we all have probably heard about is HCG. Our HCG does rise. That's what causes us to pee on a stick and have our positive test. It is a hormone that actually is excreted in our urine. So as it rises, the kidneys get rid of it, and we see that on those pregnancy tests. So that actually helps thicken our uterine lining and kind of prepare our body to not have a period and keep our pregnancy. Progesterone also prepares our uterus for pregnancy. Progesterone will continue to keep rising throughout the pregnancy. This is really important, and some of you that have struggled with infertility are probably aware of progesterone and how it can really affect us getting pregnant and staying pregnant. So it actually helps keep our body from attacking our baby's DNA, because our baby's DNA is not like ours, and so it looks like it's an invader. And so progesterone keeps our body in check to say, no, we're not going to do that. And so when our progesterone levels don't rise like if they should, then sometimes we can struggle with some miscarrying and things like that. So a lot of people that struggle with infertility will take progesterone either prophylactically, or because they've had things happen in the past, then their physicians will put them on that. So, but progesterone is very important during pregnancy. Estrogen, this helps with fetal growth in the uterus, and it helps stimulate oxytocin during pregnancy, which we all know, love hormone. So we start feeling towards the end of pregnancy, we get kind of a rush of oxytocin that kind of makes us nest and get ready for the baby. And as that oxytocin starts to increase at the end of pregnancy, that's when it kind of helps us with labor, which we will get to. And it helps prepare the breast for breastfeeding, oxytocin does, or estrogen does. Relaxin. Relaxin increases during pregnancy. It helps loosen everything. It relaxes everything. Our ligaments get nice and loose. Helps prepare our bellies to grow and our pelvis to expand and grow for baby. Relaxin actually stays kind of high 12 months postpartum. So it's very important to kind of be aware of, you feel kind of clumsy or you feel like kind of hyper flexible. Those things are due to this relaxin, but it can actually kind of cause us to be a little more accident prone during those times. So just kind of being aware of your body. If you exercise frequently, there's a lot of information online. That's not my forte. We're just here to talk about hormones, but the relaxin being higher, you do sometimes need to modify exercises a little bit, just because you need to be aware that your body might be a little more flexible or looser than you're used to. Oxytocin helps with uterine contractions, and we'll talk about that shortly. And then prolactin. Prolactin is kind of, it's more of a postpartum hormone, but we do have a lot of prolactin kind of floating around during pregnancy. Helps prepare our breasts for lactation. All right, so first trimester, our HCG is up. We're nauseous, we're tired. It's because our HCG is very high. Headaches, breast tenderness, this is all related to the HCG. It makes us emotionally sensitive. So when you're kind of losing it at the first trimester, it's related to this HCG that's going on. And then relaxin really kicks up in that first trimester. So the clumsiness and things that I had mentioned before, that's going to be really during that first trimester when you're really feeling a lot of that. So it's hard sometimes. People are like, you don't even look pregnant, but like you feel pregnant in your first trimester because of all the hormone changes. Progesterone starts to go up. Progesterone, because it helps progesterone makes your arteries expand a little bit, and so it can make your blood pressure drop. Things like getting up out of bed and then you feel dizzy, like you're gonna fall over. This is all because we're gonna have higher blood volume during pregnancy to help support this other body that you're growing inside of you. So it's important, but then we have some side effects with that. So because it relaxes things, we get heartburn, nausea, vomiting, constipation, gas, where you maybe had a little bit of gas and you just kind of came out and you didn't feel like you had any control over it. It's because of this. So it can be embarrassing, but just know that like this is just part of, unfortunately, part of pregnancy. That's in the first trimester. Second trimester is when our estrogen starts to go up. This is where we start getting our enlarged ducts, our breasts start feeling like they're getting a little bigger, preparing to hold milk for the baby. You start to get that lovely glow of pregnancy. Everybody's like, oh yeah, like look how lovely you look, because when our estrogen is high, we're in this like prime time of our female. I mean, it's estrogen, it's our female hormone. So you're glowing, your breasts are starting to grow. And that's when your appetite starts to kick in because of estrogen. That's in the second trimester. And then in the third trimester, the biggest change in our hormones at that time, our oxytocin is really starting to creep in. Our nesting is kicking in, 38 weeks of pregnancy, and then it helps us go into labor. So we'll talk about labor really short because labor is a very small piece of the puzzle here when we're looking at 9 months and 12 months postpartum. So oxytocin spikes, helps us have contractions. Remember that for postpartum. So contractions of our uterus, but it contracts muscles in general. So it helps contract our uterus so we can have our baby, and then it helps contract our uterus immediately after postpartum to keep us from bleeding too much. So that uterus is huge, and it's now down to the size of a fist, maybe a grapefruit. And it stays about that size for a week or two until it's back down to a ping pong size ball that it is normally. So the oxytocin is very important after delivery. But then our placentas deliver, and our estrogen and progesterone. Our estrogen, for picture, it is 6 times higher than our normal pre-pregnancy level during the third trimester. That is a lot of estrogen, and it just plummets during our immediate postpartum in those first couple days after postpartum. But the good thing with this is it's not blocking our prolactin anymore, so now we can make milk for our baby. So estrogen and progesterone kind of block the receptors for prolactin. So we've got prolactin, it's kind of helping make milk ducts, but that's why we're not just like making a ton of milk until the baby comes. When our estrogen and progesterone drop, that cues our body, okay, prolactin, you're allowed to work now. So it doesn't matter if your baby's early, your body still knows it's time for it to make milk because your placenta came out. So postpartum. Prolactin during the postpartum period, it's done its job helping make our milk ducts. Now it's to secrete milk into the ducts. So not to secrete milk out of our breasts, but into the actual ducts that hold the milk. When we breastfeed, if we decide to do that, it's highest about 30 minutes after we feed. So it's really important to our next feeding. It's not really important to the current feeding. So that prolactin release is really slow. It happens, it says, hey, you need to make milk now. So your baby has fed, usually in the 30 minutes, and now your ducts are empty and ready to make more milk. And this is where our supply and demand comes in. So it's very important the first few days, as hard as it can be sometimes for our first time moms especially, to maybe skip a night feed and try to get some sleep while somebody else feeds the baby. We kind of get into this, we kind of start snowballing out of breastfeeding. But those first few days, it's so important because of the supply and demand. There's so much research out there about the first few days of breastfeeding and its effect on our milk supply at 12 weeks and 3 months postpartum. Those that don't stimulate enough, maybe your baby's really sleepy, maybe your baby went to the NICU, maybe you were just tired and somebody else was feeding the baby. But when we're not stimulating the way we should, then we see deficits with our supply down the road from it. So the supply and demand is so important. The prolactin has to be able to do its job, and we can't do that if we're skipping a feed, because then it's not knowing the baby needs to feed again. So those night feedings through the first couple weeks, so important. We actually have, we call it a hormone surge in the middle of the night, and that's your prolactin. So because the powers that be made it that way, through the middle of the night is when we have our biggest surge of prolactin, usually around 3 a.m. for people in normal sleep cycles. So if you work night shift, that might be a complete different thing, but people that are typically going to bed at a normal time and getting up in the morning, 3 a.m. is our surge. We really want to take advantage of having that surge so that we can protect our milk supply and make a lot of milk for our babies. So I do like to mention that. Sometimes people are like, I don't know what went wrong, and a lot of the times it's that nighttime feeding that they're like, I just wanted to get sleep, and so somebody's helping feed the baby. And those feedings, it's better to replace a feeding during the day, or maybe that early nighttime feeding, like the 9 p.m. feeding. Maybe you can get to bed early right after dinner and try to get a little bit of sleep, but don't skip the real middle of the night one. Oxytocin. So that's what prolactin does. It makes our milk for us. Now we've got oxytocin, the love hormone. We just feel so snugly with our baby. We have all this oxytocin rushing through our system, and it helps contract muscles, remember? So it contracts our milk ducts and pushes milk towards the baby. So this oxytocin is the one that says, release the milk. So that's when you're kind of spraying milk. And oxytocin is such an interesting medicine or hormone in general, but it's kind of the hormone that like makes us into a mother, that nurturing, mothering, loving hormone with your baby. So it's amazing. So our milk ejection reflex gets cued when we have this surge of oxytocin from the baby suckling at the breast. And this is when moms say, well, I went to the grocery store and a baby started crying and it started leaking milk, because you're thinking of your baby and that love you have for your baby. And sometimes it could be just an overwhelming feeling of love. You're hugging somebody that you enjoy being around, a spouse or a family member maybe you haven't seen in a while, and then you feel like, now I'm leaking milk. Why am I leaking milk? Because your milk ducts are full, and that's what oxytocin is supposed to do. It's supposed to contract those muscles in the ducts to make the milk come out. So very interesting, but that's why that happens. So anybody that's happening to is normal, but it's oxytocin is amazing. And then I just wanted to talk about, so postpartum depression, baby blues, what's the difference? So when estrogen and progesterone just like drop off after the placenta comes out, everybody kind of has a little bit. If you don't, you're very lucky, but most people experience baby blues, and this can happen for about 2 weeks as our hormones try to figure life out now that placenta is gone. And really it's related to our thyroid. So it kind of puts you in a hyperthyroid state for a short period of time. And they've noticed that hypothyroidism in general can kind of lead to depression or depression's type symptoms. And then treating the hypothyroidism can actually increase decrease your risk for the actual depression. Like the depression symptoms start to go away. So you kind of are in this weird state of like your hormones are trying to figure things out. Now your estrogen, progesterone just dropped off. Your thyroid's like, I don't know what to do. So it's putting out a lot of hormone. TSH is high. TPO antibodies are high. When those are high, you're actually in hypothyroidism. So you're low for that. So it's a weird space to be in, but it's normal. I don't think it's talked about enough. And I just wanted to put that out there that like feeling a little sad a few weeks after pregnancy, a couple weeks after pregnancy, that's pretty typical. Things you want to watch out for though, you want to be alone all the time. You're crying all the time. You feel sad all the time. You need to talk to your provider. That's not baby blues, and I think sometimes we kind of say, oh, it's baby blues like for the first few weeks and not really recognizing the more severe symptoms need to be treated. So I do like to talk about that. And your provider can help you kind of navigate that, but advocate for yourself, because postpartum mental health, I think sometimes as women, we kind of just get kind of sloughed off a little bit and aren't taken seriously. So it's normal to be a little sad. A lot sad is not okay. And then, when we wean from breastfeeding, our oxytocin obviously takes a plummet because we're not getting all that lovely snuggling with our baby. So very normal to feel anxious about stopping breastfeeding, to be irritated, and just to be kind of sad. And not just sad that breastfeeding's over, but like your body's actually making you sad because you don't have as much oxytocin rushing around. And then I just wanted to do some fun facts. So I know a lot of people are like, oh my gosh, I'm so thirsty when I'm feeding, or I just get so sleepy when the baby's feeding, and we can thank oxytocin for that. And then because our estrogen plummets, we have hair loss. Why is my hair falling out in clumps? Like I'm brushing my hair and it's like all of my hair is falling out. Well, those luscious locks that we had during pregnancy, because our estrogen is cranking, tells our body during pregnancy, we don't have to let go of any of this hair. We just keep it all. None of it has to go. We're in like an anti-shedding time of our hair, okay? And then our estrogen plummets. And now it's like, let go of all the hair. All the hair that we should have lost is now coming out. So it was hair you probably should have lost a little bit at a time that is just all falling out at the same time. So it seems a lot more dramatic than it is. But that is why. It's because of the estrogen, lovely estrogen. Our estrogen is almost in menopausal range. So a lot of these symptoms we're having kind of mimic menopause, like decreased sex drive, losing our hair, and natural lubrication, ladies. So this is normal, and you just need to, I think that talking about these things that are happening to our bodies is important with people that are close to us. So have that conversation. We have a less of a sex drive and like low libido, and we don't have natural lubrication. So it's not going to be like something that we want to just go and do and have some fun. So talking and having open conversations, making sure that you're comfortable. Obviously, there's a lot of different lubrications out there that aren't natural, but you can do that to be more comfortable so that it's not something that kind of you're feeling guilty about. It's normal. It's just not talked about. And that's why. And then the night sweats. That's the last thing that I was going to talk about. You wake up in the middle of the night drenched, and you're like, what is happening? Again, it's another kind of menopausal symptom. This decrease in estrogen tells our hypothalamus, you're hot. Your estrogen is like plummeted, you're hot. So we gotta sweat to cool you off. Even if you're not warm, your hypothalamus is like your internal thermostat, and those hormones are telling it, hey, it's real hot, so we just need to like sweat and be cold. And that's just hormonal based. There's really not a ton we can do about it. You can try to dress a little bit more appropriately, have a towel you sleep on top of during the first few months while that kind of tries to ease itself off. Unfortunately, breastfeeding moms might deal with night sweats a little longer because with the increase in prolactin because of breastfeeding, it keeps our estrogen lower. And so that low estrogen, again, is going to tell our hypothalamus, hey, you're hot. Because you are hot. Women, you guys are hot. So, I think that's it.
Okay. So what does a lactation consultant actually do?
Okay.
So give me a brief synopsis, because this
Okay.
is a little niche we're
Right.
kind of showcasing here.
Okay. So my background, super quick. I am a nurse. I've been a nurse since 2012, and my larger part of my background in nursing is OB nursing, so postpartum, L&D, NICU, and nursery. So I really like the pregnancy part and labor part, and really I understand it, and I can understand where people are coming from, which leads me to when you're pregnant, you can see lactation. And we can go over how did past deliveries go? What is your planned delivery this time? Sometimes you know you're going to have a C-section. You know you have to have the baby early because of some other underlying condition. But I know, and most lactation professionals know, well, what does that mean for your lactation journey if you have your baby early or you have your baby via C-section? So then we can kind of prepare you for that immediate postpartum period, which is so important. Like I said, those first 3 days, the first 2 weeks are so important. So I would like to kind of say we're in the likes of like dental work. You don't want to go see your dentist when you're having a problem. You want to see your dentist before you're having a problem. And that's kind of, lactation care is preventative. So come chat with someone. It doesn't have to be me. If you're from somewhere else, there's a lot of us out there. But going over your medical history, kind of understanding lactation for you and what your hormones might be doing after you have your baby. If you have PCOS, hypothyroidism, it can do different things for your supply. And so we can help you troubleshoot that. And the earlier the better. We don't want to see you 2 weeks out when you're having the problem, kind of like dental work, right? So, and then obviously after you have your baby, most people know if you're having troubles, it's hurting, you don't have a good supply, baby's not growing, then you get a hold of a lactation consultant. Or you get a hold of us so we can just follow you closely and catch things before it turns into something bigger. We do weighted feedings. I do weighted feedings at your house, and go over your medical history and go over your pump and your pump flanges and all the things, anything and everything. Really, it doesn't have to even be lactation specific. You need to bottle feed your baby. Okay, I can help with that. Anything that you need, really, I can help you with. So
Okay. And you told me you usually like to see people at least 2 weeks before delivery, kind of prep you, or earlier, and then definitely after delivery. A couple of visits after delivery, like you said, those first 2 weeks are most important. Taylor serves the McHenry County area in Illinois. Is there a place that, and we did tag your business, is there a place that you can, if they're out of our reach, our area, is there a website or somewhere they can reach if they want to find a lactation consultant?
Yes, so I'm actually an independent contracted through like a billing company for some of my insurance clients. It's called the Lactation Network. So if you're not in this area and you don't know of anybody, you can go through the Lactation Network. It's just called the Lactation Network. And you can fill out your information, and if they approve you, they like your insurance company and will work with your insurance company, then they will find you a lactation provider in your area.
Okay.
And link you up.
All right. Thank you for your time today,
Yeah.
Taylor.
Hey.